If you are older and do not ejaculate, do so immediately. Urologist Explains. Dr. Narita. Hello, gentlemen. If you find yourself in the phase of life where you've reached 50, 60, or even further, and you've noticed a distinct alteration in your intimate experiences, specifically when you achieve that peak of pleasure, that powerful moment of climax, but without the anticipated presence of seminal fluid, then this message is of paramount importance. Perhaps this has occurred only a single time, and even that solitary instant sent a ripple of apprehension through you, creating a knot of worry in your stomach. Or it might be a more persistent silent concern that you've been grappling with privately, harboring a sense of shame or a quiet dread about what this change might signify for your overall health. I am Dr. Narita, a urologist with over a decade of dedicated experience, focusing specifically on the vital health of men across all stages of their lives. Today, I am here to engage in a conversation that is both serious in its subject matter and profoundly supportive in its intent. First and foremost, I want to impress upon you that your concerns are understood. The shift you are observing in your body is not an indication that your masculinity has diminished or that your intimate life has reached its conclusion. Consider it rather as a sophisticated message your body is relaying, a message that simply requires proper interpretation. Please stay with me because in the coming minutes, we will delve into the surprising underlying causes, the critical warning signs that should not be overlooked, and most importantly, the clear and manageable solutions that modern medicine has at its disposal to help you reclaim your peace of mind, your confidence, and your general sense of well-being. Before we embark on dissecting the reasons behind the absence of fluid, let's briefly, and in a straightforward manner, review how this bodily process typically functions. Imagine your body's reproductive system as an exquisitely synchronized orchestra. The testicles are responsible for producing sperm. The seminal vesicles then contribute the majority of the nourishing, rich fluid that comprises the bulk of the seminal emission. The prostate gland plays its part by adding a protective fluid to this mixture. This complex cocktail is then meticulously gathered and prepared within the urethra. At the moment of climax, a series of specific muscles engage in a potent, rhythmic sequence of contractions, designed to propel this fluid mixture forward and out of the body. It is an event that unfolds rapidly, a direct consequence of the delicate and precisely timed interplay between your nervous system, various glands, and your musculature. Now, here is a crucial distinction that I want to emphasize, gentlemen. Climax and ejaculation are not synonymous. Climax refers to the neurological sensation of intense pleasure, a sensation orchestrated by your brain and your nervous system. Ejaculation, on the other hand, is the physical act of expelling the seminal fluid. For the vast majority of your lives, these two events have occurred seamlessly, perceived as a single unified experience. However, it is vital to understand that they are driven by distinct physiological mechanisms. Our focus today, therefore, is on what is technically termed dry ejaculation. This is the medical designation for the situation where a man reaches the peak of climax, experiences that characteristic sensation of intense pleasure, but observes little to no seminal fluid being released. Many men describe this experience to me in my office as an empty orgasm. This disparity between what is anticipated and the reality you are experiencing can understandably fuel worry, and I completely empathize with that. You have grown accustomed to a tangible, physical manifestation accompanying this intimate event. However, it is critically important to grasp this concept. Your capacity to experience pleasure can remain entirely intact as it is governed by your nerves and your brain. The change you are noticing pertains to the mechanical delivery system. This does not signify a loss of your virility. It simply indicates that a component of your body's intricate plumbing system has a specific identifiable reason for this alteration. Before we move on to enumerate the primary causes, I would like to make a brief pause. If you are finding the information presented here to be valuable, please consider clicking the like button. This action signals to YouTube that this content is relevant and helpful, thereby enabling it to reach a wider audience. Furthermore, I encourage you to subscribe to our channel. By doing so, you will become part of our ever-growing community dedicated to men's health. And please, do not hesitate to leave a comment below. I am always eager to know where in the world you are watching from. It is truly inspiring to witness this brotherhood of men supporting one another across continents. Now, let us systematically break down the 3 most common reasons for experiencing dry ejaculation. Understanding the why behind this phenomenon is the essential first step toward regaining a sense of control. The first primary cause we will explore is what we refer to as the gatekeeper is too relaxed. This condition is technically known as retrograde ejaculation. It is, by far, the most frequent reason for dry ejaculation. Let's consider the underlying biology. Picture a small, muscular valve acting as a gatekeeper situated at the exit point of your bladder. During the climax, this valve is supposed to contract firmly, effectively sealing off the bladder. This closure ensures that the seminal fluid is directed solely forward, exiting the body through the urethra. However, if this valve is not sufficiently contracted or is too relaxed, the seminal fluid, following the path of least resistance, flows backward into the bladder. You will still experience the full intensity of the climax and the associated pleasure, but because the fluid has not exited externally, the sensation is perceived as dry. A practical and often non-alarming clue for this condition is noticing that your urine appears cloudier immediately following intimacy. This is due to the seminal fluid mixing with your urine within the bladder. The practical causes for this relaxed valve are often linked to certain surgical procedures performed on the prostate or bladder. While these procedures are frequently successful and medically necessary, they can sometimes impact the delicate nerves that control this specific valve. Additionally, retrograde ejaculation is a known potential side effect of certain medications prescribed for conditions such as high blood pressure or an enlarged prostate. These medications are designed to affect blood vessels, but they can also inadvertently cause relaxation of this tiny muscle. I recall a patient, a man of considerable pride, who was deeply distressed following successful prostate surgery. The moment he understood that the issue was purely a mechanical alteration, akin to a traffic light perpetually stuck in the open position, and that his desire and his capacity to experience pleasure remained entirely unaffected, he experienced immense relief. Our second major contributing factor to dry ejaculation is what we term the plumbing is blocked. This refers to duct obstruction. In this scenario, the seminal vesicles and other glands are indeed producing the seminal fluid as they should. However, imagine the small ducts through which this fluid travels as tiny delivery pipes. If these pipes become blocked, the delivery vehicle, the seminal fluid, is unable to pass through. Consequently, the volume of fluid released is drastically reduced, or it may disappear altogether, even though the production itself is functioning normally. The practical causes for these blockages can include scarring that may have resulted from previous infections, such as a severe, untreated case of prostatitis. In rarer instances, small calcifications, essentially tiny stones, can form within these ducts and obstruct the passage. The practical signs of this condition can sometimes be subtle. Some men might report a new, mild discomfort in the pelvic region during climax. Others may have observed that the seminal fluid has gradually become thicker and less abundant over an extended period. The excellent news is that many of these obstructions can be effectively addressed. Often, medication can be used to manage inflammation, or, if necessary, minimally invasive procedures can be employed to restore the normal flow of fluid. The third major area that warrants investigation when experiencing dry ejaculation concerns the fuel is low, referring to hormonal factors, specifically low testosterone. Testosterone serves as the primary fuel source for the male reproductive system. It plays a crucial role not only in regulating sexual desire and sperm production, but is also absolutely essential for the optimal functioning of the prostate and seminal vesicles, which are responsible for producing the majority of the seminal fluid. When testosterone levels decline significantly, the entire reproductive system tends to slow down. The emotional impact of this decline can be significant. Initially, you might notice a reduction in the volume of seminal fluid. However, over time, this deficiency can manifest in several ways: decreased libido, less firm erections, and a generally less intense sensation during climax. On a broader systemic level, men experiencing low testosterone often report feelings of fatigue, mood fluctuations, and a loss of muscle mass. The practical solution for this condition, often diagnosed as hypogonadism, is a treatable hormonal deficiency. If a simple blood test confirms a deficiency, carefully managed hormone replacement therapy can often restore not only better fluid production, but also improve energy levels, desire, and overall quality of life. It is a common mistake to simply attribute these changes solely to the natural aging process. While the majority of the time, the causes we've discussed are manageable, as your doctor, I must also address the critical exceptions. Dry ejaculation can, in certain circumstances, serve as a red flag for more serious underlying medical conditions. This is precisely why paying close attention to any accompanying symptoms is absolutely crucial. When should you seek immediate medical attention? If dry ejaculation appears suddenly and without a clear explanation, especially if it is accompanied by pain, the presence of blood in your urine or seminal fluid, fever, or a noticeable loss of sensation in the genital area, do not hesitate. These symptoms necessitate an urgent urological evaluation. Certain neurological diseases, such as Parkinson's disease or uncontrolled, long-standing diabetes, and in rare but serious cases, specific types of urological cancers can interfere with the body's plumbing or the nerve signals that regulate ejaculation. The emotional impact of experiencing dry ejaculation is undeniably real. Beyond the purely physical aspects, we cannot afford to overlook the profound emotional toll this can take. Many men tend to equate the presence of seminal fluid with their sexual performance and their overall virility. When this physical manifestation disappears, feelings of inadequacy, anxiety, and frustration can begin to take root. It is not uncommon for men to start avoiding intimate encounters altogether, driven by a fear of judgment or a feeling of being incomplete. The most crucial step in breaking this cycle of emotional distress is through knowledge and open communication. Understanding that this is a physiological change rather than a personal failure can lift an enormous burden. Your ability to experience pleasure, achieve and maintain erections, and enjoy deep connection does not solely hinge on the presence of seminal fluid. Your intimate life can, and indeed should, remain a source of joy and fulfillment. To conclude, I want to provide you with a clear and supportive action plan to help you regain control of this aspect of your health. Firstly, do not ignore it. Investigate it. The sudden or progressive onset of dry ejaculation warrants a visit to a qualified urologist. A thorough medical history, a physical examination, and often a simple blood or urine test are typically all that is required to reach a clear diagnosis. Secondly, actively manage any underlying health conditions. It is imperative to keep chronic conditions such as diabetes, high blood pressure, and elevated cholesterol levels well under control. These conditions can directly impact the vascular and nerve health that governs the entire process of ejaculation. Thirdly, break the silence. Engage in open and honest conversations with your partner and, crucially, with your doctor. Articulating your feelings and concerns is not only liberating, but also paves the way for finding effective solutions. Remember, professional support, whether it involves adjusting medication or undergoing a specific treatment, is your most powerful tool for restoring confidence and well-being. In summary, gentlemen, the absence of seminal ejaculation is not an indictment of your intimate life or a definitive statement on diminished masculinity. It is, rather, a signal from your body that deserves to be heard and thoroughly investigated with the guidance of a medical professional. Understanding the specific cause, whether it is mechanical, obstructive, or hormonal, is the foundational step toward achieving peace of mind. I have witnessed countless men successfully regain their confidence, their vitality, and their joy in living after receiving a clear diagnosis and a tailored action plan. Your vitality is not measured in milliliters of fluid, but in your overall health, your sense of well-being, and your capacity to live life to its fullest and connect deeply with others. Do not allow doubt or shame to prevent you from seeking the answers you deserve. Acting proactively and in a timely manner can fundamentally transform your experience, restoring the sense of security and intimate connection that you deserve. If you have found value in this information, please consider sharing it with a friend, a father, or a brother. This knowledge has the potential to genuinely alter someone's perspective. Please leave a like to help this important message reach more men and subscribe to the channel, ensuring you activate notifications so you don't miss our future content dedicated to men's vital health. Remember, your best years can still be ahead of you. Be proactive, be confident, and stay blessed. I am Dr. Narita, and I look forward to seeing you in the next video.